We are delighted that the German Research Foundation is funding our CRC treatment expectation with 12 million euro. What do we mean with treatment expectations? Patients have expectations about their symptoms, disease and treatments. And we want to investigate how these expectations impact health and treatment outcomes. That can be a medical or any other form of treatment. If expectations have positive effects, we call them placebo effects. If they are negative, we call them nocebo effects. In both cases, the driving force behind the effect is the expectation, which can influence both the cause of the disease and the efficacy of the treatment. We are an interdisciplinary team of physicians, psychologists and basic scientists based in Essen, Hamburg and Marburg. In the first 4 years, we will focus on the effects of expectation in 2 common diseases, chronic pain and depression. For these 2 conditions, the influence of expectation is already very well documented in both clinical and experimental studies. And we believe that therapies that would take treatment expectation into account could substantially improve treatment outcomes for many patients. What exactly do we investigate and how do we do it? Our vision is to uncover the mechanism underlying expectation effects so that these effects can be used to enhance modern personalized medicine. That means that we have to understand what exactly is happening in the brain and the rest of the body. Which symptoms and diseases are influenced the most by expectations? Why do these effects differ from patient to patient? And how do expectations combine or even interact with the pharmacological effects of a treatment? To answer these intriguing questions, we will look at expectation effects at very different levels, from the molecular basics to interaction between mind and body. Our approach is highly interdisciplinary. We work in teams of basic scientists and clinicians with various backgrounds. There are psychologists, physicians and scientists such as computer specialists and molecular biologists among us. Our work is translational because we move from bench to bedside, but also back from observing a phenomenon in our patients to mouse models in the lab. A great challenge will be to understand difference between individual patients. Our goal is to find psychological, biological and clinical factors that can predict who is likely to benefit from expectation effects the most. To achieve this, we need a large amount of data and a well-coordinated strategy which can only be realized in a collaborative effort such as in the CRC. And we are very glad that we can also collaborate with international partners in this project. Our goal is to create a scientific foundation to systematically target individual expectation effects in the clinical context to improve treatment outcomes. A patient's positive expectation could, for example, reduce the amount of drugs they need and thereby minimize the risk of unwanted side effects. But the implications of our research go much further. They could change how practitioners communicate with patients, how patients are informed about disease, therapies and diagnostic procedures, and even how patient information sheets are designed. The insights gained by our research are also highly relevant for optimizing clinical trial designs so that we can improve drug discovery and development. At later stages, we also want to investigate other diseases in addition to pain and depression. And in the end, and that's our hope, we will be able to tailor and optimize the efficacy and tolerability of treatments to each individual patient.